My name is Yuli, and today I will be talking about Leishmaniasis, a prevalent and deadly tropical disease. Leishmaniasis is caused by several species of Leishmania, which is a trypanosomal protozoan. They are termed hemoflagellates because they live in the blood and have a single flagellum, and the single flagellum is what separates Leishmaniasis from other closely related organisms, including Trypanosoma brucei, which is African sleeping sickness, and Trypanosoma cruzi, or Chagas disease. This organism exists in two phases: the promastigote phase, which has a single flagellum, as you can see. It uses this to move around its environment in search for a viable cell to infect. Once it reaches this cell, it turns into the amastigote phase, which lacks mobility and replicates within the cell prior to cell destruction and escape. The vector or carrying organism of Leishmaniasis is the phlebotomous sandfly. This is not a mosquito, it is a different creature, and it is not particularly picky in what it feasts on. It is known to take blood meals from humans, dogs, and rodents. The prevalence of the sandfly, as well as Leishmaniasis, is pretty broad. It exists in southern Europe, Africa, Asia, and South America. As you can see, many of these regions are third world, and this lack of resources and lack of medical infrastructure is what contributes to this disease's significant mortality rate. This disease has two forms: cutaneous leishmaniasis and visceral leishmaniasis. Cutaneous leishmaniasis is limited to skin and connective tissues, as well as the mucous membranes of the mouth, and is typically non-fatal. Visceral leishmaniasis is systemic and involves the liver and spleen, as well as the bone marrow, and this is the leading cause of death. It is also known as Kala Azar or black fever. The cutaneous life cycle is as follows. The organism typically exists in sandfly saliva. When the sandfly takes a blood meal on a susceptible host, the organism is introduced to the intracellular matrix of the skin, or the lower layers. This elicits an immune response, and the organism is taken up by macrophages, which are differentiated white blood cells specifically designed to consume and digest invaders. The organism then happily loses its flagellum, becomes an amastigote, and begins replicating inside the white blood cell. If another sandfly takes a blood meal in an infected host, some of these infected white blood cells transit through the proboscis of the sandfly and end up in the gut. There, the organism can live indefinitely and again transits to the saliva, where it can later infect another host. The cutaneous presentation begins as a single 1 centimeter painless nodule, as you can see below. This is fairly nonspecific. This could be a spider or bug bite. This, however, rapidly progresses to satellite papules, as you can see on the bottom there, as well as this ulcerated, depressed lesion, and this is very typical of the disease. These can be profoundly painful, and some of them can be quite disfiguring. These typically heal but leave significant scarring, and this has been known to result in other issues such as respiratory issues due to infected airways, etc. The visceral life cycle is very similar. The sandfly bites the host, it's introduced in the skin, taken up by the same macrophages. However, some species are capable of leaving the skin and moving to systemic circulation. Once they're in systemic circulation, they are capable of invading the liver, spleen, and bone marrow. And these three organ sites are vital for continued existence of the host, and this is why this particular type of leishmaniasis is deadly. Splenomegaly is enlargement of the spleen. As you can see on the right, the large mass on the patient's left side is the spleen. Typically this should be less than the size of your hand, and here it has pressed all the other organs away. The spleen typically recycles red blood cells and helps to mature white blood cells. enlargement of the spleen can lead to an increase in red blood cell destruction as well as early white blood cell death. And this leads to anemia, or low red blood cells, leukopenia, low white blood cells, and thrombocytopenia, which is low platelet count, which predisposes you to bleeding. The visceral presentation can have a significant incubation period of up to 3 to 6 months. It typically presents as undulant or recurring fever, typically twice a day. Immune system suppression can be seen. This will present with co-infections by organisms that typically shouldn't cause an infection, and it can also cause a functional anemia. Death is quite common. It causes 200 to 400,000 deaths a year, and co-infections with other organisms are typically the leading cause of death. The disease itself is not fatal. Treatment for visceral and cutaneous leishmaniasis is sodium stiboglutenate, the mechanism of which is unknown, and amphotericin B, an antifungal. The typical cost is $15 to $30 per course, which in American terms is pretty reasonable, but in terms of third world countries, this can be prohibitively expensive, especially when regular hospital care is not available. Resistance to these two drugs can occur, and if resistance is seen, then the patient typically has little options in terms of recovery. Now, very obviously, more drugs are needed to treat this disease, and this is where current research is going. Other treatment or management options include vector control. If we can manage the sandfly and its rate of attachment to humans, we can therefore limit the spread of the organism. Just like with mosquitoes, typical vector control methods include insecticide-impregnated clothing. Here you can see a bottle of permethrin. Bed netting, which prevents sandflies from feasting on sleeping patients. And then limiting human exposure to animals. Leishmaniasis has been found in regions of high deforestation, especially in the rainforest. And the reason for this is that the typical human barrier, or barrier between humans and animals, is degraded, and therefore the two are in close proximity, and the sandfly can do its business of feeding alternatively on both. The next step involves vaccine development. Natural immunity follows this infection, but it is limited to the specific subspecies that infected the host. Current research involves taking proteins from a wide variety of species, along with a wide variety of proteins, combining them and injecting them into, in this case, golden hamsters, to see if we can elicit resistance to at least one species. There is also a clinical trial underway in Bihar, India, where they implemented the most promising cocktail of proteins, the results of which are not yet available. Other important factors are detection methods. Since this disease has a significant incubation period, methods other than microscopic visualization are important. Now, typically, drawing blood and hunting for amastigotes and white blood cells is extremely time-consuming and statistically improbable. So more sensitive methods such as PCR or ELISA, as well as immunofluorescence, are being explored. PCR implements detection of DNA. ELISA involves binding of protein antibodies to our target antigen, which is probably portions of the organism. And then there also is an emphasis on animal detection. If we can identify at-risk animal populations, we can also limit the spread of the disease. New drugs are difficult to synthesize because protozoans are eukaryotes, just like we are, so there is significant cross-interaction between the two species. A drug that can harm humans will also harm the protozoans and vice versa. There is a rather surprising finding that calcium channel blockers show promise in limiting organism survival. This is good because calcium channel blockers are typically used for high blood pressure, so that is perhaps the only upside to having high blood pressure. So in conclusion, Leishmaniasis is a pervasive and deadly disease, especially in the third world. It has multiple and persistent animal vectors, which means eradication is very difficult, unlike malaria, which is dependent on its mosquito host to survive. Limited treatment and detection options uh, make fighting this disease particularly difficult, and new research is needed in order to combat Leishmaniasis. And here are my references. Thank you very much.